I'm Lee Kiedrowski. I'm a family medicine physician at CHI in Dickinson, North Dakota. So the mRNA vaccine is a new generation of vaccine. Previously, we've given weakened viruses or bacteria, we've given inactive organisms, or we've given just important pieces of the organism as a vaccine to let our bodies have a natural immunologic reaction to it, to provide defense antibodies and memory cells so that we don't have significant illness or hospitalization or death if we do get into contact with those organisms again. What the mRNA vaccine does is provides a blueprint to our bodies so that we generate the spike protein, or the important protein that the virus uses to get into our cells. It allows us to make that protein and then present it as though it were an actual live infection to our bodies. So it gives us the benefit of the protection without the risk of actually getting the disease. And what we've seen thus far is that the mRNA generation of vaccines has been very effective, up to 95% protection. Well, there's always risk to getting vaccinated, but then the risk of not getting vaccinated means that that you're putting yourself at a risk of getting a disease that could be preventable. And the mortality risk of some of those are not that high, but the morbidities or the symptoms of those diseases are quite significant and could result in hospitalization or even long-term issues. So in my clinic, I've found it pretty easy to convince those who are at high risk of mortality and morbidity from this virus to receive the vaccine. And those who are having a much less risk, I seem to have a little bit more difficulty convincing them to get the vaccine. And so what I share with all my patients in regards to vaccines is to assess your own level of risk. And we go through many steps, talking points to understand their individual level of risk. So age, heart disease, lung disease, diabetes, other comorbidities that may affect them and put them into a higher risk category. So again, what we try to do is to risk stratify each patient so that they can make their own educated decision on getting the vaccine or not. I think all of my patients who have not had an adverse effect from other vaccines should get the mRNA vaccine. I think they should get the COVID-19 vaccine because it has been so effective at preventing death and disease, and also spreading it to other people. So there are a lot of reasons to consider getting the COVID-19 vaccine. You all need to take your own risk level into account. But when you do, make sure you try to take care of yourself and those around you who might not be able to protect themselves. I would give the vaccine to any one of my family members, and I would urge you to consider the same.